And welcome back to The Factor Uncensored. Well, health officials in Texas are still working to stop the state's biggest measles outbreak in at least 30 years. My next guest has more information on what warning signs you need to look for and what parents need to do. And joining us on The Factor Uncensored tonight, we have with us Dr. Danish Ali from Archpoint Pain Institute. Dr. Ali, a time of concern here in Texas and around the country. We're seeing now a measles outbreak, and I think we've had right about 500 cases or 499 cases in Texas. 2 children have died, and we have a passenger at the airport to worry about. What do we know so far, Dr. Ali?
That's correct, Isaiah. We are seeing an outbreak in the cases of measles. As we've discussed previously, Isaiah, measles is a virus that spreads very rapidly. It spreads through the air droplets and from someone maybe sneezing or touching a surface, and it can stay on that surface for over 2 hours. Therefore, most recently, as we discussed at the Hobby Airport, there was a case where there was a gentleman who had a confirmed case of measles, and he traveled on March the 30th, anywhere from between 4 to 8 p.m. He was at the airport, and so officials are encouraging those folks that may have traveled at that time frame through Hobby Airport, if they develop any sort of symptoms such as fever, chills, a rash, those sorts of symptoms, then they're urged to call their local ER and let them know that they may have an exposure to measles so they can properly get tested and determine if that person does in fact have measles. As I said, Isaiah, this spreads very rapidly, and that's why we're seeing this. In the cases that we're seeing, especially those kids that both have died as a result of measles, Isaiah, both of them were unvaccinated. Therefore, the message that is coming across that we are trying to relay everyone is that if you have not gotten your MMR or your measles vaccine, then you need to get that immediately.
For those who say, well, and here's the thing, many people say believe in the science. The science is there. It will make you 97%, I think, is the correct and accurate number, safe from the measles. But many people just won't get their children vaccinated because they believe in these different theories, in some instances, conspiracy theories out there. How do you reach those parents who may be putting their child's life on the line? Because when you think about the measles, all but eradicated here in the United States, and people don't take it that seriously anymore. But now we see children are dying as a result of not having these vaccines.
That's correct, Isaiah. So the answer is behind the research, Isaiah. This has been shown, this has been given for many years, has been shown to be an effective vaccine, 97% effective after the second dosage. So it is very effective. It comes with very minimal side effects or complications or anything like that. And those are all things that you discuss with your pediatrician or even your pharmacy to just make sure that you qualify, those folks that are perhaps immunocompromised, meaning they have some sort of condition that compromises their immune system. They may not be the best candidates. And so this vaccine isn't for everyone, but it is definitely something that should be discussed with your provider, especially your pediatrician, especially if you have not been vaccinated. And as we've previously discussed, Isaiah, if you were born after 1957, but you were vaccinated before 1968, those vaccines were not as effective. And so those are the folks that we're also recommending to get potentially revaccinated. So therefore, if you were born between that time frame, you want to talk to your primary care doctor and see if you do qualify. Beyond that, we talked about the kids that need to get it as well. Sorry.
And because we talk about COVID and booster shots and all of that, is there such a thing in measles? And for those who those who have been inoculated after 68, that would be like 56 and older. Should they consider getting another shot, even if they had it
after 58? Is that something that's even in the cards?
Yeah, after 68, 1968. So again, just to make sure.
68.
Yeah, so if they're born after 1957, but they were vaccinated before 1968, those folks at that time frame that were vaccinated, the vaccines are less effective at that time. And therefore, those are the folks that need to talk to their primary care doctor again and see if they would qualify. In terms of kids themselves, Isaiah, for the first dosage is generally given at the 12th to 15th month mark, and then the second dosage is usually at the 4 to 6 years. But now, given that there is an outbreak, this is, if your child is maybe 3 or 2, this is a time frame to talk to your primary doctor or your pediatrician and say, hey, listen, is this an appropriate time to possibly give an earlier dosage, even though we should be waiting a little bit longer? But now with this outbreak being in Harris County, especially with schools, in how rapid this virus really is it appropriate to get this at this period of time?